and gentlemen, to our channel. Since the last video about suicide, we've gotten a lot of questions, a lot of feedback, guys. And one of the most interesting topics that have come up is suicide among families. And the big question that is coming out is that are there families that are more prone, or what is this thing with having different people in one family dying by suicide? So that's what we want to discuss, gentlemen. And we want to remind our viewers that suicide is the act of intentionally ending one's life. And so the key question we want to discuss today is, what are some of the factors that contribute to suicide, and what are these, and how do these factors apply now in some families that you end up finding so many cases? So we are going to discuss maybe 3 or 4 factors, and we want to tell our viewers that these factors are intertwined. There is no single factor that contributes to suicide. So maybe
and even to add to that, even as we are looking at suicide among families, it's always good to remember that suicide is always unique to every individual. And even as we are looking at these factors, it's good to remember that even as we are looking at the factors, we should not overgeneralize suicide, even if it is in families. But we are going to start looking at the factors, and Antipas can take us through the first factor.
Yeah. Thank you. And we'll start by looking at genetic factors. And as you have said, that it's an interaction of complex things, and that's why we're saying genetics play a huge role, and it is actually intertwined with mental health conditions. So we are going to see the relationship between the two. And we may want to start by saying that the current research or evidence that is there hasn't really shown the specific gene that is intertwined with suicide when we look at families, but more work is ongoing, and probably in our subsequent interactions we'll be able to see what research will tell us. But there is a high connection between genetics and suicide, and genetics play a huge or an important role in defining if there will be a predisposition or a risk towards suicide. When we look at mental health, we're seeing sometimes this suicide will come as a result of an underlying mental condition. Probably if one hasn't been diagnosed yet, it could be a symptom of an illness like depression, or even bipolar, or even schizophrenia, which are mental health conditions. And that is why we are also going to look at what are some of the interventions that are there that will help us or help these families know, is it suicide as a standalone, or is it suicide that has come as a result of an underlying mental condition? I think I'll allow George to take us through.
Na hapa ndipo hata, even before I take over my next point, kuna zile familia utaona kabisa kuna mtu wa kwanza has died by suicide, unaona wa pili has died by suicide, then watu wataanza kufikiria hiyo familia watu ukufa tu by suicide. Lakini ukiangalia deep into the matter, unapata hiyo familia wanakuanga na depression.
Exactly.
But the depression has never been diagnosed, has never been treated. Na hizi symptoms za depression ndizo zinafanya hawa watu wa hiyo familia to die by suicide. And now to the second factor that we're going to be looking at, or the third rather, is environmental and social factors. When you look at environmental and social factors, one of the key aspects is family dynamics. Family dynamics ni venye familia ina relate between one individual to the other individual. Unaweza pata mama hasikizani na baba, and that whole creates a whole dysfunctionality. And when there is that dysfunctionality, labda hata hakuna hiyo communication, unapata labda kuna shida, watu hawaongei, na hiyo inaleta mashida, and you might find one case or another into dying by suicide. Then also on environmental and social factors, kuna hii part ya trauma can happen in families. Kuna family utasikia watu walivamiwa na wezi, and during that invasion wakafanyishwa vitu zenye hazikuwa, that were very traumatic. And now since that is a shared event, inaleta a lot of turmoil in the family members. If it is not addressed, since they are unable to cope with that specific event, that traumatic event. Unaweza pata for example wa kwanza has started contemplating suicide, then after one dies by suicide, unaona hao wengine wanaanza kufuatilia. So trauma and stresses can also lead families to die by suicide.
Okay. And I think the third or the fourth pointer is following also on what you are saying, is what we call learned experiences. So there's a question of is it conditioning? Are these families conditioned to die by suicide? And I think if you were to take the example of what you're talking about, trauma and shared experiences, you may realize that some families over time have had maladaptive coping skills. So it's like almost an association of this person had pain, and the solution they got was to intentionally cause their death. So it's almost like a coping. Yeah, babangu alikufa, alijiua, kwa hivyo hata mimi solution yangu ni kujiua. So that's what we would call learned behavior. Families might learn behaviors that are not good in terms of viable solutions. And now the major question, Antipas, that we want to ask today, and this is always the question when we talk about suicide: is there hope? Is there hope for these families? Is there hope for the individual? What are the available interventions for preventing suicide, so that at least this conversation can really help our viewers?
Thank you, Tuku, for that. We'll say indeed there is hope, because we always like preaching preventive care. Yeah? We arrest it before it costs or it takes a life. And we'll say we have clinicians who will help these individuals who in one way or another have portrayed or have displayed symptoms or features that are consistent with loss of hope. Sometimes utasikia mtu akisema hey, maisha mimi imenichosha, ama ndugu yangu dadangu alifanya hivi ama vile, hey, hata mimi sijui what am I going to do, because we have seen they are using maladaptive ways of coping, yeah, to deal with this emotional pain. So tunataka kuona kuna matumaini, and we are going to say yes, matumaini iko. All we need to do is identify ni nani anaweza kuwa akizungumzia hali ya kusema amepoteza hope with life, they are tired of living, they say this life is not worth living. So we encourage them to go to hospitals and see clinicians. These clinicians could include psychologists or even psychiatrists who will run their assessments, take them through therapy, explore what are these triggers that are predisposing them, because we have seen suicidal behavior, there is a risk towards suicidality, and that is where now the experts are going to explore and actually advise further if it's going to be inpatient treatment or outpatient treatment, depending on the level of severity.
So if a family realizes that mtu wetu kuwa anaongea mambo ya kujitoa uhai, ni vizuri huyu mtu apate kusaidiwa.
Correct. Na pengine kuongeza hata zile tabia wako nazo. We have seen people being inclined towards certain types of movies or towards certain types of novels. Unapata zile vitabu anasoma ni za jinsi ya kutekeleza hii mambo ya kujitoa uhai. So that could be an indicator that probably they are struggling with a thing or two with regards to suicide.
Okay. George, you can also tell us what are the available options maybe for families.
Now when you look at it at a family level, hata tukiangalia zile maswali tulikuwa tunapata kwa mtandao, kuna watu walikuwa wanauliza a certain family is doomed. Is it that this
familia yetu ni kama, hata mimi ni kama
nimeelekea tu hapo, sababu babangu alijitoa uhai, mamangu alijitoa uhai, my eldest brother alijitoa uhai, so ni kama pia mimi nimeelekea hapo. So is it that we are doomed? Na kwa hayo tunasema, especially kama you have noticed a specific pattern in your family, it doesn't have to be your immediate family. Inaweza kuwa pia ni family ya your uncles. That means there's that genetic aspect. When you realize that, mnaweza enda nyinyi wote as a family unit to see a psychologist, to see a clinician, so that nyinyi wenyewe muangalie hizo factors tumeangalia, do they apply to you? Is there that aspect of genetics? Is there that aspect of mental illnesses? Is there that aspect of learned behavior and the environment? Or is it a combination of all of them? So that ultimately you deal with them from a very holistic point of view. Lakini sasa watu wakiendelea kusema certain families are doomed without actually addressing the issue, probably that could happen. Yeah. And huku perhaps sasa kwa sababu hiyo swali liliulizwa sana, tunaweza waambia, is it that hiyo swali iliulizwa sana, is it that certain families are doomed? Is it a fact that kama kuna watu walikufa kwa laini ya familia yenu, pia wengine atafuata?
And I think that is where we are going to conclude this discussion by saying, yes, the research says that kuna familia ambazo ukiangalia utapata a lot of suicide. Yeah. Na vile tumesema ya leo ni kwamba hatuwezi sema sana ati ni tu kwa sababu ni hii familia ama ni ile familia. Tumeona kwamba within those families kunaweza kuwa na mambo mengi ambayo yanatendeka, ambayo yanachangia watu kwa hiyo familia wajitoe uhai. So I think the key point today is that there is help, there is hope for families, and the best thing is, as we always say, prevention is better than cure. So ukisha realize mtu ameanza kuongea mambo yanakaribia kwamba anataka kujitoa uhai, ni vizuri tutafute usaidizi, and we hope that this message goes out there to all families. Your family is not doomed. If assessed well, if treated well, then we can prevent the next suicide in that family. Thank you so much, viewers, for interacting with us, and let's meet again. You can also look up at our numbers at our facility, and we continue helping mental health to go to greater heights. Thank you so much.